Hey YouTube, this is Amy. This is my second um, video chronicling my weight loss journey. You have to forgive me, I've actually recorded this video twice and they both failed, so third time's a charm, right? At this stage in my journey, I'm approximately 2 days away from surgery, so I'm well into the pre-op liver reduction diet in the home stretch, thank God. um, At this point, I'm drinking liquids only. So I'm drinking chicken broth, protein shakes, certainly lots of water, some decaf coffee, sugar-free popsicles, sugar-free Jello. I have been cheating a little bit. Hopefully, the stuff that I'm cheating with is good, I suppose, if that's a thing. I'm not eating carbs or anything like that, but drinking lots of liquids and stuff, and sometimes a girl, just has to chew on something. So I been nibbling on a little bit of beef jerky here and there, so just so I can just gnaw on it for a little while, get that sensation of chewing, which I terribly miss. Additionally, I'll have something like a low fat, a light low fat cheese string, so that way I can like pull the individual strands off and milk that for a little while, and it makes you feel like I'm interacting with something. So although I have been cheating, I'm still losing weight. So I'm almost 3 weeks into it, and I've lost almost 21 pounds, which is great. Like I said, the surgery is the day after tomorrow, which is March 10th, 2016. My surgery is going to be at Rex Hospital in Raleigh, North Carolina. My surgeon is Dr. Michael Tyner, and really excited. I had mentioned in my first video that I'm having a procedure called SIPS, which is relatively new. It's kind of the new kid on the block. Not a whole lot is known about it in terms of long-term effects. I had mentioned in my first video that it's kind of a hybrid of the VSG as well as the RNY, which is true, but there's something that I didn't mention, and that was it's almost similar. It's almost like a modified duodenal switch. So I will have a pouch, like the sleeve. They're also going to do a portion of rewriting my guts, my intestines. I can only have a single anastomosis. The difference between SIPS procedure and what is traditionally done in the RNY is that I won't be prone to dumping syndrome, which is something that kind of factored into my decision. So the RNY takes a good chunk of your stomach, just like this will too with mine. But the difference with mine is that I am going to retain my pyloric valve, which is the valve inside your stomach that will control when food leaves your stomach and goes into your intestines. So with the RNY, if you eat too much or eat too quickly, or eat something that you're not supposed to, boom, you'll start the dumping process, which means you get sick and all that stuff. With my procedure, I will not suffer from that, which is nice. In a traditional duodenal switch, the common channel, after they do the rerouting of the intestines and all that, the common channel is about between 75 centimeters to max 150 centimeters. So with that, because your intestines are significantly reduced, there's a lot of malabsorption. So a lot of times duodenal switch patients have to eat lots of fat. So like full fat sour creams, full fat cheeses, full fat, lots of bacon and oily meats and stuff like that, because they're not going to absorb it. It's going to go through their system much quicker. But at the same time, with those particular patients, they have to take a lot of supplements, lots of multivitamins, because their malabsorptive system is just it's not absorbing all the fat and all that bad stuff, but it's also not absorbing all the nutrients. So they got to take lots and lots of pills. So my doctor with the SIPS procedure recommends a common channel of 250 centimeters. So like I said, with the DS, it's between 75 and 150 max. Mine's 250, so it's longer, which means I will still have some malabsorption, which is good, but my doctor highly recommends the SIPS with a longer common channel because it has less risks for complications long term. There will be some malabsorption, which is great, but there's not going to be all the complications. So it's kind of the sweet spot, and that's the kind of goal, and that was what I felt was right for me. Because SIPS is relatively new, there's not a whole lot of support groups out there for it. So there's lots of support groups and forums for the VSG or RNY or duodenal switch, but not a whole lot for SIPS. I found a couple of groups on Facebook, which are good. But learning a lot about the malabsorption and stuff like that, that's really important with my surgery. So I've been looking at the DS boards, the duodenal switch. And a lot of people out there, they seem to be poo-pooing it. And, they really got me kind of shaking my confidence because they were talking about, well, if your doctor's billing it as a DS, but you're actually having a SIPS, that's insurance fraud, and you would be implicit in all this stuff. And it was just like, whoa, okay, that's a lot of negativity. That's a lot of negativity. So I kind of took a step back, asked some questions of my doctor, which he answered, and I'll go into that in a little bit. But ultimately, I feel it's important to have a good relationship with your surgeon. I understand cutters cut. He's a surgeon. All he does is cut. But I have a good relationship with the nutritionist, I believe, with their practice as well. And, I spent a lot of time with my surgeon explaining to him about my history with food, my history with my medical history, what kind of person I am, what I tend to go for, what I gravitate towards, and all that sort of stuff. And I believe that he recommended the right procedure for me. I went in there saying, I'm going to have the VSG. He's going to tell me the VSG is it for me. And then once we started talking a lot, he actually recommended SIPS. And I don't believe that there was any, he wasn't trying to swing me one way or another because he gets a kickback or anything like that. I truly feel like he's looking out for my best interests. And I think it's really important to have a lot of confidence and to trust your surgeon that he's going to do what's medically is right for you. And he considers the long-term goals. So I kind of took a step back from those boards, and there's a lot of negativity on the internet. It's kind of like, you go to WebMD if you've got the sniffles, and all of a sudden it's like worst case scenario, you've got brain cancer and all this stuff. And so now I'm just going to take what they say kind of with a grain of salt. It's not Bible. So I feel confident this is what's right for me. So I'm going to plow forward, and I'm excited about it. Haters going to hate. So like I said, I talked with him, asked him a few questions, and that's where we had the discussion about the common channel versus SIPS, with SIPS versus duodenal switch, and that's why we talked about the 250 centimeter common channel. I asked him if I was going to have a drain after surgery, because I've read a lot of reports from people saying that they woke up in recovery and they had a drain on their stomach, and it was really, really painful. So I asked him if I was going to have one, and he said no. So his goal is no. He said drains are really put in place when people have the suspicion that there might be a leak. So he went into depth and told me a lot about what he's going to do when he's in there. So he's going to use, 2 staple lines and all the stuff. And then, he's going to blow the organs up to make sure there's no leaks. And, there are several different QA sort of tests to make sure everything's going to be okay before he seals me up. If he's in there and he suspects, something looks a little hinky, it might be susceptible to a leak, then he would do it. But he said the leak rate is extremely low because of all of those things that they do to make sure before they close you up. So I feel confident with that, and that would be great not to have that. Let me just take a sip of my delicious dinner. It's like room temperature now, too. Delicious. I asked him if he was going to remove my gallbladder, because that seems to be a common theme online as well, that when people have their surgeries, they also have their gallbladder removed. He told me that that was not his goal. He probably wouldn't do that. He said there's going to be a lot of trauma going on in there with, the pouch and the rerouting of the guts, that if he doesn't need to remove the gallbladder, then he won't. Apparently with my ultrasound on the gallbladder, everything looks fine, but if he gets in there and there's a bag full of rocks, then he'll probably take it out. But if it's not hurting me, then he'll leave it in there. I also asked about a hernia. A lot of people seem to have hernias fixed when they have their surgery. So I asked him, I said, listen, do I have a hernia? If I do, are you going to fix it or what? And he said, all of my medical records and all my tests and x-rays and all that stuff indicate that I do not have a hernia. But, of course, if he goes in there and he finds one, then yes, he'll take care of it and close me up. Last week I had a pre-op appointment at the actual Rex Hospital. So I went there and met with a really nice nurse. named Brenna. She was fantastic. And she kind of gave me the scoop in terms of what to expect. So first we went through my medical history. I had to bring all my prescriptions for my hypertension, for my thyroid, and all that stuff. And so she told me that I didn't need to bring any of that with me to the hospital. That's why they're taking it. So they administer medicine as they saw or as they see fit while I'm there. She told me what to take the morning of, which of my medicines to take the morning of, and which not to take. We talked about what to expect the day of surgery, what I should do, what I need to do in terms of hygiene, bathing with the appropriate, antibacterial soaps and stuff like that, not wearing any stuff, and like jewelry, not put any lotion on, or like face moisturizer after getting out of the shower. And then we talked about what happens during surgery, recovery, what's going to happen with my husband, what he's going to do, what to expect, that sort of thing. So my surgery, like I said, is on Thursday, March the 10th, 2016. I'm hoping to go home over the weekend. My husband is overly ambitious. He's hoping that I'm going to come home on Friday, but, fingers crossed that can happen. I got a lot of protein shakes here that I bought from the Envision store, which is like a bariatric supply shop in the same office as my surgeon. I bought 12 different protein shakes in different brands, different flavors, because who knows what's going to happen with my taste buds after surgery. Who knows what I'm going to like, who knows what I'm not going to like, and I didn't want to be stuck with an entire case full of something and I can't stomach it. If my stomach's not going to tolerate it, then why on earth did I spend that much? So I just picked a handful, and then whichever ones I like, whichever ones I can tolerate, I'll just buy more of those. Speaking of protein shakes, so like I said, I've been drinking these ones. These are Bariatric Advantage. I've been drinking them 5 a day. I had to buy them in big bags, 2 big bags, to get me through this pre-op diet. And I'll tell you, pro tip, get Torani sugar-free syrups, because they will help. I got tons of flavors. I got raspberry, peppermint, mocha. This is Irish cream. I got s'mores, blackberry, salted caramel, which is awesome. So they're good to kind of change the flavor of these shakes every once in a while. I also add them to my coffee, my decaf coffee, throughout this. I have been noticing, and I think my friend Sister Scaleback, RNY Kathy, you can probably attest to this. When it comes to these protein shakes with the syrups and the sugar-free popsicles and the sugar-free Jell-O, there's just a lot of sweetness happening. So occasionally I will drink some chicken broth too, and that one, it's warm and it's salty and it's savory and it's so good. Because quite frankly, I'm getting sick of this sweetness now. I mean, I do have a sweet tooth a little bit, but enough is enough. And I'm really looking forward to, obviously, chewing food again after the surgery, which will actually, I can only start introducing semi-soft foods at week 3. So the first 2 weeks post-surgery are liquids only. Protein shakes, I've got to focus on protein, liquids, and hydration. They seem to really push hydration. So lots of drinking water and staying hydrated, and then focusing on protein as well. And then after 2 weeks, and then I can start introducing things like semi-soft foods. And semi-soft foods, I mean, like, that's the awful pureed food stage, which I'm not super looking forward to, because it'll be just pureed food. But I'm sure by that point I'll be starving for anything. So pureed food, I mean, some things I really like. Like, I love cottage cheese. I'll eat cottage cheese all day long. So I'm looking forward to that. Some strained soups and strained yogurts. Protein fortified sugar-free pudding. By that I mean I'll just add I've got some unflavored protein powder that I'll add to it. Maybe some applesauce, and I think I only do that for a week, thank God. And then after that, that's when I can start introducing like soft foods again, like scrambled eggs. Like I would love to have a scrambled egg with some cheese or something like that. Oh my gosh. But to be honest, I could cut somebody to have a grilled cheese sandwich right now. I do miss carbs, but I got my eye on the prize, and I'm focused and I'm ready. I just got to get through these last couple of days. I hope that these were the worst part of it. But that's really the scoop. So This will probably be my last video until I'm on the other side, really, until after surgery. I'll try to do an update while I'm at the hospital, but excuse me, but who knows how I'll be feeling there. So I might not be able to provide an update while I'm there. At the very least, I'll do one when I get home. And I think that's about it. So thanks again for hanging out with me tonight and talking with me. I appreciate you stopping by. If you have any questions or suggestions or advice, please feel free to, reply in the comments. I'm all ears. And if that's about it, I guess I will catch you all on the loser's bench. All right, take care. Good night.